Hi everyone, my name is Chinmaye Thakur. I am a second year medical student and today we will discuss sensory system and reflexes. Hello, how are you?
I'm fine.
What is your name?
My name is Shiveshwarya.
Your age?
I'm 18-year-old.
Okay, so today we will be doing the sensory testing and reflexes. So let's start.
Okay.
To test pain, use a sharp safety pin. Ask the patient, is this sharp or dull? Or when making comparisons, does this feel the same as this? Apply the lightest pressure needed for the stimulus to feel sharp. Avoid heavy pricks that draw blood. To prevent transmitting a blood-borne infection, discard the pin or other device safely. Do not reuse it on another person. Testing skin temperature is often omitted if pain sensation is normal. If there are sensory deficits, use 2 test tubes filled with hot and cold water. Touch the skin and ask the patient to identify hot or cold. With a fine wisp of cotton, touch the skin lightly, avoiding pressure. Ask the patient to respond whenever a touch is felt and to compare one area with another. Avoid testing calloused skin, which is normally relatively insensitive. To test vibration, use a relatively low-pitched tuning fork. Tap it on the heel of your hand and place it firmly over a distal interphalangeal joint of the patient's finger. And then over the interphalangeal joint of the big toe. Ask what the patient feels. If you are not sure whether the patient is feeling pressure or vibration, ask the patient to tell you when the vibration stops. To test proprioception, grasp the patient's big toe, holding it between your thumb and index finger. Demonstrate up and down as you move the patient's toe clearly upward and downward. Then, with the patient's eyes closed, ask the patient to say up or down when moving the large toe in a small arc. Repeat the test several times on each side. Test stereognosis. Place a familiar object such as coin, pencil or cotton ball in the patient's hand and ask the patient to tell you what it is. Normally, a patient will manipulate it skillfully and identify it correctly within 5 seconds. If arthritis or other conditions prevent the patient from manipulating an object well enough to identify it, test the ability to identify numbers. With the blunt end of a pen or pencil, draw a large number in the patient's palm. A normally abled person can identify most such numbers. Briefly touch a point on the patient's skin. Then ask the patient to point to the place touched. Normally, a person can do so accurately. Lesions of the sensory cortex impair the ability to localize points accurately. Stimulate one side or simultaneously stimulate corresponding areas on both sides of the body. Ask where the patient feels your touch. Normally, both stimuli are felt. If the patient's reflexes are symmetrically diminished or absent, use reinforcement. Ask the patient to lock fingers and pull one hand against the other. Tell the patient to pull just before you strike the patellar or Achilles tendon. Place your thumb or finger firmly on the biceps tendon. Aim the strike with the reflex hammer directly through your digit toward the biceps tendon. Observe the flexion at elbow and watch for and feel the contraction of the biceps muscle. Flex the patient's arm at the elbow with palm towards the body. Strike the tricep tendon with a direct blow directly behind and just above the elbow. Watch for contraction of the triceps muscle and extension of the elbow. The patient's hand should rest on the lap with the forearm partly pronated. Strike the radius with the point or flat edge of the reflex hammer about 1 to 2 inches above the wrist. Watch for flexion and supination of the forearm. Briskly tap the patellar tendon just below the patella. Note contraction of the quadriceps with extension at the knee. Placing your hand on the patient's anterior thigh lets you feel this reflex. If the patient is sitting, partially dorsiflex the foot at the ankle. Strike the Achilles tendon and watch and feel for plantar flexion at the ankle. Also note the speed of relaxation after muscular contraction. If the reflexes seem hyperactive, test for ankle clonus. Support the knee in a partially flexed position. With your other hand, dorsiflex and plantar flex the foot a few times while encouraging the patient to relax. Then sharply dorsiflex the foot and maintain it in dorsiflexion. Look and feel for rhythmic oscillations between dorsiflexion and plantar flexion. Normally, the ankle does not react to this stimulus. Test the abdominal reflexes by lightly but briskly stroking each side of the abdomen above and below the umbilicus. Note the contraction of the abdominal muscle movement of the umbilicus toward the stimulus. With the key or wooden end of an applicator stick, stroke the lateral aspect of the sole from the heel to the ball of the foot, curving medially. Closely observe the movement of big toe, normally plantar flexion.